Welcome back to PodWavePulse. I'm excited for today's deep dive. We love getting into those reports and data and really unpacking the big issues. And this one is massive. It's all about mental health right here in Australia.
It's a critical topic, and I think the report you sent me really highlights that sense of urgency. We've been talking about mental health for a long time, but the data in this report sort of paints a picture that things might be getting worse, not better.
Exactly. And it makes you wonder why. We've had all these national plans, reforms, initiatives, and yet the numbers are still going up, especially among young people. So I think our mission today is to really dig into that, why try to make sense of this data and figure out what it all means, for us, for our listeners, for the future.
I think that's a really valuable goal, and I'm hoping we can, shed some light on some of those really complex factors that play.
All right, so let's jump right in. The report starts by laying out what it calls the current crisis. And wow, some of these stats are pretty alarming. Did anything jump out at you right away?
Well, I think the first thing that hits you is that 1 in 5 Australians aged 16 to 85 experience a mental disorder every year. That's a huge proportion of the population.
Yeah, that's a lot of people. And you think about the impact that has not just on individuals, but on families, communities, the whole country, really.
Absolutely. And then when you break it down further and look at the younger generation, the 16 to 24-year-olds, the numbers are even more concerning. The report shows a pretty dramatic increase in mental disorders in that group, from 26% in 2007 to a whopping 39% in 2021.
That is a really sharp rise in a relatively short time frame. I mean, what's going on there? It's like something's not working right.
Well, that's the big question, isn't it? And what's especially interesting, or maybe I should say worrying, is that this increase has happened despite all those national mental health plans and reforms we talked about. It makes you wonder if those efforts are really hitting the mark or if we need a more fundamental shift in our approach.
Yeah, it's like we're putting Band-Aids on a much deeper wound. And something else that really stood out to me, the report points out this really significant gender disparity in those numbers. Like for young women in that 16 to 24 age group, almost half of them, 48%, are experiencing a mental disorder.
That is a stark figure. It really highlights the unique pressures and challenges that young women are facing in today's society. There's a whole range of factors that could be contributing to that, from social media and body image to academic pressure and gender inequality.
So we're not just talking about individual struggles here. This is a major public health crisis impacting a huge segment of our population, and particularly our young people, and especially young women.
Right, and the report is really clear about that. It emphasizes the urgency of this issue and the need for a really comprehensive overhaul of our mental health system.
Okay, so let's get into some of those contributing factors. The report highlights a few that I think are worth exploring in more detail, starting with socioeconomic changes and rising inequality. How do you see these broader societal trends impacting mental health?
Well, it's a complex issue, but there's definitely a link between economic hardship and mental well-being. When people are struggling financially, when they're worried about making ends meet, putting food on the table, keeping a roof over their heads, it creates this chronic stress that can really take a toll on their mental health. And we're seeing rising inequality in Australia, which means more people are experiencing that financial pressure.
And it's not just about basic survival, right? There's also the social pressure, the comparison, the feeling of being left behind when you see others doing better, especially for young people who are just starting out trying to build a future for themselves. That kind of economic insecurity can be really daunting.
Exactly. And the report also points to the role of social media, which is another huge factor, particularly for young people.
It's interesting because social media can be a double-edged sword. On the one hand, it can be a source of support, connection, community. But on the other hand, there's all this research showing the negative impacts. The comparison, the cyberbullying, the pressure to present a perfect image, the fear of missing out.
It's like this constant bombardment of idealized versions of reality that can really distort your sense of self-worth and make you feel inadequate. And for young people who are still developing their identities, trying to figure out who they are and where they fit in it, can be really overwhelming and damaging.
Yeah. And then, of course, we have to talk about the elephant in the room, the COVID-19 pandemic, which the report identifies as a major factor in the rising rates of mental health issues, especially among young Australians.
I mean, the pandemic was a collective trauma for all of us. The isolation, the disruption, the uncertainty, it really took a toll on our mental well-being. But for young people who were at such crucial stages of their development, it was particularly disruptive. Their education, their social lives, their sense of normalcy, it was all turned upside down.
It's like the pandemic exacerbated all the existing vulnerabilities and added a whole new layer of stress and anxiety.
And we're still seeing the ripple effects of that. The report talks about the shadow pandemic of mental health challenges that we're now grappling with.
So it's not just one single cause that's driving this crisis. It's this complex interplay of socioeconomic factors, the rise of social media, the impact of the pandemic, all converging to create a perfect storm for mental health challenges.
And that's one of the key takeaways from this report. It's not a simple problem with a simple solution. It requires a multifaceted approach.
Okay, so let's shift gears a bit and talk about the other side of the equation, the mental health care system itself. The report is pretty critical of the current system, pointing to a lot of fragmentation and systemic issues that are creating barriers to access and care.
Yeah, it's a bit of a mess, to be honest. The report highlights this long-standing separation between clinical services like seeing a doctor or getting medication and psychosocial services like therapy and counseling. And these two sides often operate in silos, which can be really frustrating for people seeking help.
It's like you're trying to navigate two separate systems with different rules, different wait times, different funding models. It's just not very user-friendly, especially for someone who's already struggling.
Right. And then you add to that the outsourcing of federally funded mental health care to private organizations, which can create even more complexity and variation in service delivery.
So you've got this patchwork of providers with different eligibility criteria, different levels of quality, and different approaches to care. It's a lot to navigate.
And all of that creates extra barriers for people who are already in a vulnerable position trying to access the support they need. It can be incredibly discouraging.
So it's not just about increasing funding or providing more services. It's also about making the system more integrated, more user-friendly, more accessible.
Exactly. We need a system that's designed around the needs of the people who are using it, not the other way around.
Okay. So given all the challenges that we've been talking about, what are some of the key reforms that the report is calling for?
Well, one of the big ones is a shift towards multidisciplinary team-based care models, especially for young people. The idea is to have a team of professionals working together, psychologists, psychiatrists, social workers, peer support workers, all collaborating to provide a more holistic and integrated approach to care.
So instead of just seeing one healthcare professional, you'd have access to a whole team of experts who are all communicating with each other and working together to create a personalized care plan.
Right. And the report emphasizes that these multidisciplinary models are particularly important for young people because their needs are so complex and often intertwined. You might have a young person who's dealing with anxiety, depression, maybe some family issues, maybe some school-related stress, and it's all interconnected.
It's like a web of factors that all need to be addressed in a coordinated way.
And the current system just isn't set up to do that effectively. It's too fragmented, too siloed. We need a more integrated approach.
And the report also talks about the importance of addressing the broader social determinants of mental health as part of a comprehensive prevention and intervention strategy. What does that mean in practice?
It means looking beyond individual level interventions and tackling those bigger societal factors that we talked about earlier, like poverty, inequality, discrimination, social isolation. It's about creating a more equitable and supportive society where everyone has the opportunity to thrive.
So it's not just about treating mental illness after it develops, it's also about preventing it in the first place by addressing those root causes.
Exactly. It's about creating a society that promotes mental well-being for everyone.
Well, I think this deep dive has really highlighted the complexity and urgency of the mental health crisis in Australia. The numbers are alarming, the contributing factors are multifaceted, and the system itself is in need of a major overhaul.
It's a daunting challenge, but I think the first step is awareness. We need to keep talking about this issue, keep pushing for change, keep advocating for a more equitable and supportive mental health system.
And I think this report is a really important contribution to that conversation. It gives us the data, the insights, the recommendations we need to start moving in the right direction.
And hopefully inspire some action.
Absolutely. So to all our listeners out there, thank you for joining us for this deep dive. We hope it's giving you some food for thought and maybe even spark some ideas for how you can get involved in this critical issue. And for more in-depth explorations of important topics like this, be sure to subscribe to PodWavePulse. We'll see you next time.